Some Alberta doctors are calling on the province to declare a state of emergency over conditions in emergency rooms. They cite uniquely long wait times, a lack of beds, and staffing shortages. A declaration of a state of emergency would allow the provincial government to temporarily centralize authority and potentially mobilize extra resources. Dr. Haley Cochrane is an emergency medicine physician at the Peter Lougheed Centre and the Foothills Medical Centre. So tell us about what you're seeing in the ER right now.
Sure. So I think the biggest challenges that we're facing is that our resources are stretched incredibly thin. We have this influx of patients. We have a number of people who are very sick, and our beds are completely taken up with patients who have already come through who can't get admitted into the hospital. So they take up the beds in the emergency department, and that just sort of squeezes us between a rock and a hard place.
Now, what do you see as the biggest bottleneck or pressure in the system right now?
So I think that's challenging because there's many different challenges and there's many different things that are causing this. And I wish it was simple. I think that would be an easy fix. But we see different pressures at different times. One of the big pressures we're seeing right now is just the viral season is peaking. After spending time with each other, we end up kind of sharing some viruses. And so people are coming in sick with COVID and with flu. And then on top of that, we've just been facing, overwhelming pressures in the system for years. And so when we get these bumps, it really pressures us.
Yeah, it's interesting. One of the descriptions you gave there was people are coming in really sick. Mm-hmm. Is that the flu and COVID and the seasonal stuff?
That's a lot of it. I think that sometimes we're just sort of seeing people who, over time are aging and they're coming in with, more complex illnesses. So, when we talk to our colleagues, 20, 30 years ago, they're just not seeing the degree of illness that we're seeing now. And I think that makes our job really challenging. Interesting.
So do you feel this sort of cumulative effect of this complex, constellation of issues? Does this warrant an emergency declaration?
So we definitely are feeling the squeeze on the front lines. And I think, what's so hard about facing these challenges over and over, it just contributes to our burnout. It contributes to, that moral injury that comes with trying to make decisions with limited resources. And a state of emergency is something where we need to recognize that we're in a state of crisis. We have been for a while. It's not going to change how we approach what we're doing on the front lines. Like for the incredible people that I'm in the trenches with, we still want to provide, compassionate care. We want to take care of everybody we can, but when we're really squeezed, it just makes our job so much harder than it needed to be, or that it needs to be.
Do you, respecting that you come in here with some obligations, obviously around privacy, can you give a kind of example or a description of what you mean by moral injury?
So, a lot of times we're faced with, really obviously sick people and on the worst days of their lives. So some of the things that is so hard is if I'm going to see a patient in the hallway and I have nowhere to take them to privately tell them a life-changing diagnosis, telling some grandmother she has a new tumor in her brain that is the first sign of a cancer that started somewhere else and spread, and telling that to her family and her in a hallway surrounded by other patients, other staff members. That's so hard, that's so challenging. It's not what we deserve. It's not what Calgarians and Albertans deserve. And so, I think that's the only decision we can make when there's nothing else, there's nowhere else to go. And the more you shoulder those tough conversations or having to make really difficult decisions, the more that really just burns us out. And there's only so much you can kind of shoulder before it becomes too difficult.
Going back to this idea of the declaration of an emergency as part of trying to address the acute situation the ER emergency rooms are in across the province. Is there anything unique about right now? Like, has this gotten worse? Is it the time of year? I mean, how do you see that question of whether there's something happening right now?
So I think we faced different challenges in the year. I think right now we've really just been trying to stay afloat with how limited the system is in terms of its ability to face capacity changes. And we've kind of seen that since COVID. We've never recovered since COVID. And so, right now when we just feel worse and worse, it's never really gotten better. We've never been able to take a breath. And so when we're looking at, talking about states of emergency, it's just because we need to recognize that, we're all struggling, not just us on the front lines, the other services in the hospital. And we need help. It's a cry for help. That's what we're looking for, is support and help.
The province has recently reorganized AHS. What impact has those changes had on the front lines?
So it's tough to say, because with any sort of change or restructuring, there's always going to be challenges. You can't make changes without, hitting a few road bumps. But it hasn't really changed how I approach my patients, how I think, my amazing colleagues are approaching things. Like we're coming at it we're trying to come to people with empathy and with compassion. We're trying to do the best that we can. And then I think we're trying to be optimistic about what this looks like going forward. So it doesn't change what you're going to see in the front. I'm still going to hold your hand. I'm going to take care of you on the worst day of your life.
On trying to be optimistic about it, like, are there specific benefits you hope to see in terms of addressing some of the things you're talking about?
So I think that's there's a lot of policy changes that are kind of above where I am, and so seeing the bigger picture right now when I'm kind of in the trenches is a bit tricky. So I'm hoping that it will make a difference, but I think it's a bit early because we're still going through the process itself.
Now, a declaration of an emergency obviously would be intended to kind of like meet some short-term and acute needs. What do you want to see as long-term solutions to some of this?
So in terms of long-term solutions, I think big challenges the government has to face is just some of the shortages we're seeing in the community in terms of aged care and access to aged care, because we do see elderly patients sort of getting stuck sort of in the hospitals, and when they can't leave and go to aged care spaces, that makes it difficult for our aged patients in the emergency department to move forward. One of the things that I ask, less of from a policy standpoint, but from the community, is that we need your compassion, we need your empathy back in our space, because we recognize you're frustrated, and we recognize how challenging it is to wait and to be scared. And, we're really kind of facing the brunt of that frustration up front when we're already shouldering so much. So we would love for Albertans to come into our space and to give us some trust and some faith back.
People are burned out by the time they get to you.
Very much.
Oh, yeah. So how many people come to you? I mean, maybe how many is too specific a way of asking. What's the experience having people come to you that really need a family doctor?
So we see a lot of folks looking for family doctors. I know that we've had, a big increase in family doctors moving to the province. And so what's really great is that there's some resources on for that AHS has for connecting folks. And so I'm seeing a little bit less and less of people saying, I don't have a family doctor. We're seeing a little bit of movement in that arena, which is great.